We're under attack.
You either die a hero, or you live long enough to see yourself become the villain. I can do those things because I'm not a hero. I'm whatever Gotham needs me to be.
They'll hunt you.
You'll hunt me. You'll condemn me. Set the dogs on me. Because that's what needs to happen. Because sometimes the truth isn't good enough. Sometimes people deserve more. Sometimes people deserve to have their faith rewarded.
She definitely doesn't need a flu vaccine if she really has the flu.
She should not get it again.
No, she doesn't need it because the most potent vaccination is getting infected yourself.
Hello, Lydia. It's your dad, and we're running out of time. We need to restore trust in the public health system now in ways that no one on this planet can, like you and your sister Sydney could. You all had a beautiful, trusted relationship with some of the world's leading authorities in academic research in the areas of cancer, infectious, and chronic disease, R&D. Rest in power, Sid. We love and miss you. I'm talking about science we can trust, because SIICDARE curates science for the public good. They want to cure medical conditions without harming healthy cells, and they have no interest in making and keeping people sick for profit, which is quite the opposite approach to what Dr. Fauci's big three pharma-based solutions are doing. Taxpayers fund the R&D, and then the companies turn it into a brand name product that they can sell back to the government and consumers for thousands of % markups for something we already put the bill for. That's crazy. Fortunately, the not-for-profit I was building with my son was designed to solve these problems. So tell me, if we begin raising awareness about these alternatives to blockbuster drugs as it relates to infectious and chronic diseases that are less toxic, risky, and costly, we save trillions. Academic researchers can bring the same FDA-approved products to market for a fraction of what Big Pharma charges. What's more, for every blockbuster drug, there's often dozens of FDA-approved alternatives that are just as effective and a fraction of the cost. Sadly, very few people know they exist, except for us and Mark Cuban. But you know who really should know? Dr. Fauci, who refuses to listen to academics we can trust.
There was a study that came out of Israel about natural immunity, and basically the headline was that natural immunity provides a lot of protection, even better than the vaccines alone. As we talk about vaccine mandates, I get calls all the time. People say, I've already had COVID, I'm protected, and now the study says maybe even more protected than the vaccine alone. Should they also get the vaccine? How do you make the case to them?
You know, that's a really good point, Sanjay. I don't have a really firm answer for you on that.
In other words, he's only promoting solutions that come from Big Pharma for profit. Why else would he ignore the alternatives when it comes to improving population health? Instead of making us take experimental jabs for each new variant, doesn't it make more sense to boost the immune system so we don't get sick as easily? It's assuming you can live with the symptoms. Remember, exercising the immune system makes it stronger. And for some diseases, natural immunity can provide the best protection and is free.
She's had the flu for 14 days. Should she get a flu shot?
Well, no, if she got the flu for 14 days, she's as protected as anybody can be, because the best vaccination is to get infected yourself.
And
if she really has the flu, she definitely doesn't need a flu vaccine. If she really has the flu,
she should not get it again.
No, she doesn't need it because it's the most potent vaccination is getting infected yourself.
Which makes sense, because back in the day, your immune system would get stronger, you'd beat the cold, and you'd never catch that variant again.
The common cold coronaviruses that circulated and recirculated, I guarantee you we've been infected multiple times.
10 years from now, we should have far, far better diagnostic technology. We should have much better therapeutics, some of which will be pathogen independent. And then, as we do come up with vaccines, we want vaccines that are infection blocking and long duration. Today, vaccines don't have much in the way of duration, and they're not good at infection blocking.
Quick question, Bill. What qualifies you to make these decisions on behalf of humanity? And also, what about risks, side effects, costs, and accountability? Do you even know what you're doing? That's why SIICDARE is needed now. I'm interested in your thoughts.
If you have breakthrough infections, what's the point
And I couldn't agree more, especially when framing the risk. Severe illness, hospitalization, and death are caused by COVID? Really? Here's what Dr. Fauci had to say.
There are many, many people who have obesity, diabetes, who are on chemotherapy for breast cancer, prostate cancer, transplants. There are a lot of people
regarding excessive deaths. The reason the death count is as high as it is because both Dr. Fauci and Burke said that if you die with the antibodies or the virus in the bloodstream, either way they'll count it as a COVID-related death.
You know, I can't imagine if someone comes in, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.
If you had a pre-existing condition, if someone dies with COVID-19, we are counting that as a COVID-19 death.
By this logic, and you can check his death certificate, George Floyd probably died from COVID.
The federal government now leading the charge in collecting this information from the states, and when will it be made public?
Yes, the answer is yes. It will be public as soon as you get enough data to be able to make a meaningful statement.
How does this actually then get counted? Because I've heard, just as you have, this conversation about whether or not the death toll has been inflated, and it seems like there continues to be a lot of confusion about this number. What would you say is a better way to look at it?
The truth is, this comes down from the idea that the federal government has not put a transparent and consistent metric for how to govern deaths from this virus and even infections and how to count them, and hasn't been consistent in that way. And more importantly, how to document that consistently. We'd have a lot better data, but we just don't have that.
And that's why the FireSafe will share data with anyone that uses Vista. You see, the data that the CDC is using to track the spread and death count is weeks to months old, and it's not complete, so it shouldn't be used for decisions.
Our case numbers are coming down, and that is so encouraging. We still have 75,000 new cases a day.
And how do you know this? You don't. Making matters worse, the marketing firm that Trump hired to collect and interpret the data can't be trusted either. So the big question is, why is Biden still using them when better options are within reach? That's crazy. So if you don't count the number of people who have complex health and social issues, you'll find that far fewer people died from COVID alone than we've been led to believe. Remember, most Americans have already had the virus and had few or no symptoms, but the shutdowns and no jab, no job mandates increased deaths by despair for preventable reasons. Here's why. Tens of millions of people lost their health care, their jobs, their houses, their insurance, their ability to pay for their medications, which means they're going to die. But if you take people with complex health and social issues and financial issues out of the equation and correct for the number of people who died from despair, overdose, suicide, and alcoholism, you probably have roughly the same number of people dying from year to year, which means the virus may not be as deadly as we've been led to believe, and maybe we should resist jab mandates until we know more.
I don't think you'll ever see a mandating of vaccine, particularly for the general public.
That's probably smart since the jabs were created before the Delta and other variants were discovered. This means they might not work or might make things worse. The reason that hospitals and ICUs were overrun, where we had health workers with horror stories, cause and effect. For decades, the wealthy who own health and hospital systems have been buying the smaller ones and shutting them down, which means you have more and more people coming from farther and farther away to a dwindling number of remaining healthcare facilities, giving the illusion that things are overcrowded and overrun for all the wrong reasons. Making matters worse, there's no shortage of people who are willing to work if they were paid and treated fairly. The people who own these facilities refuse to hire enough people to meet the demands, even though there's no shortage of qualified people looking for work. This means there's going to be too few people with long hours of suffering and having to care for too many people, pulling them in different directions at the same time, all because of greed. Of greed. I'm not an anti-vaxxer. I'm just for education and choice. And I want more options to come from academics so I can trust not to make and keep me sick for profit. Check out this recent study from NIH just last week. At the country level, There appears to be no discernible relationship between percentages of population fully vaccinated and new COVID-19 cases. In fact, the trend line suggests that countries with high percentage of population fully vaccinated have higher COVID cases per 1 million people. Interesting. Notably, Israel, with more than 60% of their population fully vaccinated, had the highest COVID-19 cases per 1 million people in the last 7 days. The lack of a meaningful association between percentage population fully vaccinated and new COVID-19 cases was further exemplified, in a sense, by comparing Iceland and Portugal. Both countries have more than 75% of their population fully vaccinated and had more COVID-19 cases per 1 million people than countries such as Vietnam and South Africa that have around 10% of their population fully vaccinated. Whoa. Across the U.S. counties too. There also appears to be no significant signaling of COVID-19 cases decreasing with higher percentage of population fully vaccinated. What? I thought this was a pandemic of the unvaccinated. Misinformation. Of the top 5 counties that have the highest percentage of population fully vaccinated, the U.S. Centers for Disease Control and Prevention, the CDC, identifies 4 of them as high transmission counties. Stated differently, counties that are vaccinated at really high rates are considered by the CDC as a county that has high transmission. Chattahoochee, Georgia, McKenzie, New Mexico, and Puerto Rico counties have about 90% of their population fully vaccinated, with all 3 being classified as high transmission. Conversely, of the 57 counties that have been classified as low transmission counties by the CDC, they had percentage of population fully vaccinated below 24%, which is like the opposite of what you would expect, right? Their sole reliance on vaccination as a primary strategy to mitigate the COVID-19 and its adverse consequences needs to be re-examined, especially considering the Delta variant and the likelihood of future variants. Let me repeat that for the WHO. The sole reliance on vaccination as the primary strategy to mitigate COVID-19 and its adverse consequences needs to be re-examined, especially when considering the Delta variant and the likelihood of future variants. Such course correction becomes paramount with emerging scientific evidence on real-world effectiveness of the vaccine. That's an NIH peer-reviewed study, which gives strength to the argument against vaccine mandates. You think Dr. Fauci will follow the science on this?
I don't think you'll ever see a mandating of vaccine, particularly for the general public. But you would never mandate, at least I do not think you would. I'd be pretty surprised if you mandated it for any element of the general public.
No, I don't think it should be mandatory. I wouldn't demand to be mandatory. Just like I don't think masks have to be made mandatory nationwide.
Let me just state for the record that masks are not theater. Wearing a mask might make people feel a little bit better, and masks are protective, but it's not providing the perfect protection that people think. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. You do not need to wear a mask indoors if, in fact, you've been vaccinated. But in a situation where you have people indoors, particularly crowded, you should wear a mask. If, in fact, you are vaccinated, fully vaccinated, you are protected, and you do not need to wear a mask.
I mean, I think I've got this right. 1 mask is better than 0 masks. 2 masks is better than 1 mask. But you don't have to have double masks. Is that right? I mean,
it became clear that cloth coverings that you didn't have to buy in a store, that you could make yourself, were adequate. And then you wanted to fit better. So one of the ways you could do it, if you would like to, is put a cloth mask over, which actually here and here and here, where you could get leakage in, is much better contained.
Okay. Let's talk about the benefits of masks. Consider this. Have you ever been driving and dropped your cell phone on the floor and picked it up and kept driving, and then reached over and grabbed a French fry or a carrot stick and kept eating and driving without sanitizing anything? Your car is a petri dish, which means that the germs on your cell phone and steering wheel are a heck of a lot more deadly than anything that you're protected from by wearing a mask. This is proof that your immune system is a heck of a lot stronger than we've been led to believe, because it's fighting off things that are a lot more deadly than a mask can protect us from. So let's say no to mask mandates. They just cause problems and divide the nation, and they're not helping nearly as much as we thought. So only trust good science. They definitely make people unstable because we need to see smiles and faces. Children need them for socialization and learning. In fact, we all need them. And what we also need is science we can trust, providing guidance for the administration to resist the need for mandates, passports, shutdowns, and a culture war that can be avoided if we make better decisions, because they do a lot more harm than good, costing millions of jobs, tens of millions of families being affected. We need a better path forward before it's too late, one that comes from people we can trust, which is the benefit of SIICDARE, working with academics who practice science for the public good, and FIRES.org. Fortunately, World Health Organization, Mexico, India, Brazil, and Germany, and many other countries around the world are already using VISTA, so it'll be easy to share data with them so we can coordinate our response to pandemics both now and in the future by providing curated and unbiased expert decision support to protect the health and safety of people at home and abroad by providing guidance on what actually works, not driven by politics, pharma, profits, or pursuit of power, but science you can trust. Independent, objective, and unbiased, SIICDARE's team practices science for the public good. Because like oatmeal, it's the right thing to do. It's the right thing to do.
These petty tyrants, these Democrats, who shut down businesses, who shut down stores, who shut down restaurants, who destroy family businesses that have been built for generations, and with the flick of a pen, they destroy them. Who shut down schools and left tens of millions of kids across the country not being able to go to school. And nothing shows the hypocrisy more than the theater of masks. Because every single person knows who's problem. Okay, let's see, what were the rules when they were in effect? The rules were, you walk into a restaurant, you must wear a mask. And then you sit down, take your mask off. Now this is science. At 3 feet, the virus is incredibly safe. At 6 feet, holy crap, it's gonna kill you! Like, this is just dumb. Alright, how about airplanes? Airplanes. The rule used to be, you get on an airplane, you put your mask on. You're 2 years old, you're crying, no, you must have a mask on. Because there's nothing like a 2-year-old with a mask on. But, if you pick up a peanut, take your mask off, because magically, the peanut cures COVID. Now we've got some reporters here, so they're writing down, oh, he says the peanuts cure COVID, this is fake news. No, I'm highlighting the idiocy of it. Because you put your peanut down, and oh my God, put your mask on, you're gonna kill everyone! Unless you got a Diet Coke.
Okay, let's talk about the GOP. Consider this. Even a broken clock is right twice a day, you know? Do they have any solutions that can restore trust in the science we use for public health decisions and policies? If not, then they are no better than the Democrats, because both parties suck without SIICDARE and FIRES. So the government needs us to make better informed decisions and policies, both now and in the future, because we would bring independent, objective, unbiased, curated, academic oversight you can trust to help cities, states, and nations make better informed decisions when it comes to pandemic responses. To protect the best interests of we the people, at home and abroad. So please tell Congress to support this cause. Peace, so we can pave the path to a brighter tomorrow together. For a lot less money and in a lot less time. can improve the pandemic response.